video is our second video on blood physiology, and our third topic is about the blood group. And in this video we will discuss about the blood groups and also antibody against AB antigen, ABO incompatibility, RH isomerization, and also universal donor and universal acceptor. So we will start from blood group. And blood group is a division of red blood cells based on the carbohydrate level on its cell membrane, and we can classify them as O, A, B, and AB based on this carbohydrate structure. So we can classify red blood cells carbohydrate structure based on its similarity. For example, those red blood cells with similar carbohydrate structure can be grouped as A, and also some other carbohydrate structures can classified as B, and those red blood cells with A antigen we can classify it as blood group A, and with B antigen we can classify them as B, and those red blood cells with both A and B antigen we can classify them as AB, and red blood cells without A and B antigen we can classify it as O. For example, it is a red blood cells with A antigen, and we can call as blood group A, and the other red blood cells with B antigen we can classify them as blood group B, and with A and B antigen we can classify it as blood group AB, and without A and B antigen we can classify it as O. The other concept is about Rh negative, and Rh negative and positive classification is based on D antigen. Red blood cells with D antigen we can classify them as positive, and without D antigen we can classify it as them as Rh negative. So this is our basic concepts in blood group. So our next concept is about antibody acts against these A and B antigens. A and B antigens are carbohydrates that are present on red blood cell membrane, but antibodies are immunoglobulins that are produced by our immune system to attack these A and B antigens. A and B antigens are presented on our red blood cells, starting from the production of our red blood cells, but antibodies appear in our blood after 4 to 6 months of infants or infant life, because the cause of anti-production is the colonization of our gut by bacteria. So the appearance of this antibody in our blood is by age of 4 to 6 months. It's due to the colonization of our gut by bacteria, and in this bacteria there are similar structure to A and B antigens, and our immune system produce antibody or immunoglobulins against these A and B antigens, and these A and B antigens are very similar to A and B antigens in our red blood cells, and these antibodies that are produced to act against the bacterial antigens will interact with our red blood cell antigens. So antibodies are immunoglobulins that are produced after 4 to 6 months of infant life due to the colonization of the gut by bacteria. The other very important concept is, if an individual with group A red blood cells can have only anti-B antibody, but if group A individuals has anti-A antibody, the antigen A and anti-A will interact each other, and hemolysis will occur. So group individuals only have anti-B antibody, and group individuals have anti-A antibody, and group O individuals could have both anti-A and anti-B antibody, because these individuals have no antigen A and antigen B. But when we see group AB individuals, these individuals have A antigen and B antigen. So these patients will never have anti-A and anti-B antibodies. The other very important concept that you should remember is the type of immunoglobulins that are produced against these A and B antigens. In individuals with blood group A, B, and AB, the type of antibody is immunoglobulin M. But in individual with blood group O, the antibody that produced in his blood is immunoglobulin G and immunoglobulin M. So the other concept is about Rh negative individuals. In the Rh negative individual, the type of antibodies that produce from his or her immune system is anti antibody, and this antibody is immunoglobulin G, and the cause or for the production of this antibody is not bacterial colonization of the gut, but uh, the immediate cause for the production of this antibody is the mixture or the mixing of Rh negative blood with Rh positive blood. So the production of immunoglobulin is only after exposure of Rh negative blood with Rh positive foreign blood. After exposure with Rh positive blood, the Rh negative individual immune system produce antibody, and this antibody is immunoglobulin G. So immunoglobulin G is a type of immunoglobulin, and that is very important, and that you should remember, especially in the concept of AB incompatibility and RH immunization. So what are the difference between immunoglobulin G and immunoglobulin M? When we see immunoglobulin M, it is large and not cross placenta, and it's found in the bloods of an individual whose blood group AB, and O, and it is pre-existing immunoglobulin and produced due to the bacterial colonization. But when we see immunoglobulin G, it is small and can cross a placenta and produce in two conditions. One is in individual with blood group O due to bacterial colonization, and the other is an individual with Rh negative blood after exposure for Rh positive blood. So in blood group O individual, and also in Rh negative individual. So it is the two conditions that can produce immunoglobulin G, and this immunoglobulin G is a small antibody that can cross the placenta and can attack the fetus cerebral cells, and that can lead to hemolysis, and it's a basic concept in order to understand ABO incompatibility and also Rh iso immunization. So you should remember this concept, especially immunoglobulin G, that's found in blood group O individuals and also in Rh negative individual, especially after exposure for Rh positive blood. So uh, our next topic is about ABO incompatibility.